Today I'm going to go into my inbox. I've been getting some great direct message questions from some of my followers, and I feel like some of those questions are great to bring forth and make videos about. So today's question came from a caregiver who has a loved one that is just starting the bladder cancer journey. They're actually going for their first appointment with their bladder cancer doctor. And so the question is, what questions would you have asked at your first appointment that you wish you would have gone back and asked? First of all, it's great that this cancer patient has a caregiver that wants to go to the appointments with them. I went to every appointment mostly with my wife. I also have my brother and my dad attend a few, but my wife was my main person alongside me. And you really need that second person to help you absorb it. You're already kind of in an emotional state, especially at that first meeting. And so you want to make sure that you hear everything correctly. Oftentimes we'd get in the car afterwards and compare notes. What did you hear? What did you hear? So it's important to have that second person. And second of all, it's great to go in with questions in advance because your doctor's time is very precious. They're going to be very quick because they have lots of patients to see. And so you want to make sure that you are ready with questions so that you can talk to them and be organized and make sure you get all of your questions answered in that meeting because that time is so precious. So the first thing that we came up with as something to ask is to ask them about their protocol. What is their standard of care for the type of bladder cancer that you have? Will it involve a TURBT? Will it involve BCG treatment? Will it involve a surgical procedure like I had? And if so, what order would those be in? There was even some debate with my doctor as to whether or not they would do a surgery first and then do the BCG. I ended up doing the BCG first and then a surgery. And before that was also the TURBT, the resection of the bladder, in which they are taking usually is done as part of a biopsy, and sometimes they can take the whole tumor at once. And so one of the questions that I wish I would have asked also when I got ready for the TURBT was, what kind of pain meds are you going to give me? I actually did sort of ask the question, but the answer wasn't what I needed. They gave me an OxyContin, the first doctor that I had with the TURBT, and that did nothing for my pain. So you want to ask what kind of medicine will they prescribe for bladder spasms, which is what you will experience after TURBT, and it's a different kind of pain, and there's a different kind of medication for that. You'll also want to talk to them about the timeline. And I mentioned that in the beginning with the protocol, but there will be space between each of the steps. And if you miss a step or if a step falls behind, it just expands the amount of time that you're under care. So you will want to get a rough timeline. The timeline's always going to change because it's science, and science isn't always perfect. Things change along the way, new things are discovered. And so you have to, but you want to have some sorts of a timeline because life goes on and you need to be able to plan things. You still need to enjoy your life. And with the timeline, things can get shaky. So you want to get a rough timeline, but also understand that timeline might not be so solid. If you move into BCG treatment, you want to ask what the size of the dose that your doctor gives. Because I have found through my social media networking that I've been doing that there are different doses that are given. The standard dose is 50 milliliters. Some people get a half dose and some people get a third of a dose because there are BCG shortages periodically throughout our country and have been for several years now. Usually the first round you will get the full dose for sure. Maintenance rounds might be less, but you want to know that information, and if you're not getting a full dose, you may want to check with some other doctors to see if you can get a full dose with them. And then post-BCG protocol. When you go through the treatment on a treatment day, what is the protocol that your doctor is asking you to follow as far as contact with other people, as far as cleaning and sanitation in your bathroom, what steps you need to take, to protect members of your household and members of your community. So these are some questions that we want to make sure we get out there out front. And the last question is the one that I'm dealing with now that I wish I would have asked up front. And it's not always the first thing on your mind, but you need to talk about what the copay is going to look like or what your insurance situation is going to mean for your payments. Now, when I went into bladder cancer, I said, you know what, I don't care what it costs. I want to get well. I want to have the rest of my life. We'll figure that out afterwards. Well, now we're in the figure out time, and there are some things that we're learning that we could have taken some different steps, maybe gotten care in different places because the copays differ from location to location depending on if it's a doctor's office, a clinic, or a hospital, for some people's insurance. So although that's not really the part you want to talk about, that is something that you should talk about so that you can have a plan for how you're going to deal with that during and after your care. So these are some great questions. I encourage people to continue to send me direct messages, and maybe one of your direct messages will become the subject of one of my videos. Thanks for everybody for tuning in. Have a great week.